Diclofenac really is a fascinating drug, used for everything from treating short-term pain and inflammation to even managing migraines, and it has so many layers to it.
Absolutely, it's like a multitasker in the medicine world, right?
Exactly. It's used for things like arthritis pain, menstrual cramps, and those acute inflammatory conditions.
Yeah.
And it works by blocking substances in the body that cause inflammation.
So, would you say it's sort of like putting a damper on the inflammatory fire in the body?
Oh, totally. It's like it slows down that cascade of chemicals that lead to pain and swelling, making it a go to for short term conditions.
Mm-hmm. That makes sense. But I'm curious, how is it usually supplied? I mean, in terms of forms or dosages.
Well, diclofenac comes in several forms. You have capsules, tablets, even a powder that
Right.
you mix with water. They come in doses from 18 milligrams up to 100 milligrams, depending on the formulation.
That's pretty diverse. And I believe storage is important too, right?
Correct. It should be stored at room temperature, ideally between 68 degrees Fahrenheit and 77 degrees Fahrenheit. You know, it's like keeping your medication in a nice, cool, dry place so it doesn't lose its magic.
Mm-hmm. And transporting it outside of that range for short periods is okay, right?
Yep, it can handle a bit of variation. Around 59 degrees Fahrenheit to 86 degrees Fahrenheit for shorter periods, like when you're on the go.
Now, on the topic of side effects, diclofenac really brings a range of them to the table.
Right, and the common ones include stomach pain, constipation, vomiting, even some dizziness. It's crucial to take it at the lowest effective dose and for the shortest time possible to minimize these issues.
Absolutely. But speaking of the stomach, isn't there a risk for things like ulcers or even bleeding?
Yes, that's a major caution. Diclofenac can lead to stomach bleeding, ulcers, and, in severe cases, even gut tears. And the risk increases if someone has a history of stomach ulcers or is older.
That's quite concerning. It sounds like dosing needs to be really managed carefully and under supervision.
Exactly. It's all about balancing the benefits against the risks. Healthcare providers stress minimal doses for short durations.
Mhm.
And, people should never share their medication.
And there's that added layer of risk for heart complications, isn't there?
Yes, definitely. Diclofenac can not only increase the risk of heart attacks and strokes, especially in people with existing heart conditions, but it can also lead to heart failure through fluid retention.
Right. That's a significantly serious precaution. It reminds me that all medications have a price, even if subtle.
Exactly. It's like you're negotiating a deal with your body. You get relief, but you need to be on guard for those severe effects.
I also read that severe allergic reactions can occur, like DRESS. What's that all about?
Yeah, DRESS stands for drug reaction with eosinophilia and systemic symptoms. This reaction can hit multiple organs like your liver,
Oh,
kidneys,
wow.
heart, and even cause breathing issues. It's a red flag. Stop the drug and get help if any of that shows up.
And in relation to the liver, there seems to be a really detailed warning about liver damage, too.
Correct. Diclofenac can cause hepatotoxicity. Symptoms like nausea, yellowing of the skin or eyes, and dark urine should ring alarm bells to stop and consult a healthcare provider immediately.
That's definitely something patients need to keep an eye on. What about interactions with other drugs?
Oh, this is a big one. Diclofenac interacts with a lot of other medications. For instance, blood thinners like warfarin, other NSAIDs, corticosteroids, and even some heart medications like ACE inhibitors and beta blockers.
Yeah? I imagine that could complicate treatment quite a bit if someone is on multiple meds.
Absolutely, and that's why a complete review of all medications, including over the counter and herbal supplements, is vital before starting on diclofenac.
It almost sounds like a high stakes balancing act, where one misstep could lead to, say, high blood pressure or even kidney damage.
You got it. High blood pressure is another caution. Diclofenac might increase your blood pressure or make it worse. Side effects like fluid retention, kidney issues, even elevated potassium levels are on the radar.
Right. And what happens if one accidentally overdoses or misses a dose?
Well, if you overdose, you need to get emergency medical help, dialing 911 or contacting a poison control center. If you miss a dose, the advice is pretty straightforward. For regular treatments, Take it as soon as you remember, unless it's almost time for the next dose. But never double up, especially for migraine treatments that are meant for occasional use.
That's a clear guideline. It's really about following the prescription to a T.
Yes, and there's also a big focus on special population warnings. For instance, people over 65 might be at greater risk, and pregnant women, particularly past 20 weeks, should be extremely cautious because of potential harm to the unborn baby.
Mm-hmm. And breastfeeding? I believe it passes into breast milk, right?
Exactly. Breastfeeding mothers need to talk to their healthcare providers before starting Diclofenac because of that very reason.
Now here's something interesting. There were notes about photosensitivity too. How does that tie in?
Right. Diclofenac can make your skin extra sensitive to sunlight. So, if you're outdoors, you might end up with severe sunburns or blisters. It's like your skin is saying, "Hey, I need extra protection out here."
Right. So, wearing sunscreen or protective clothing is a must if you're on it.
Exactly. It's a small extra step that can really help mitigate that risk. Also, a heads up. If you ever notice unusual symptoms, be it rashes, severe stomach pain, or breathing troubles, it's critical to reach out to a health professional immediately.
I appreciate that emphasis on being proactive with any signs. It really underscores the importance of monitoring your own health while on such medications.
True, and even though diclofenac has a diverse range of uses, it's really not something you take lightly. It needs a vigilant approach both from the prescriber and the patient.
Mm-hmm. I do wonder, though, sometimes people might argue that given all these potential risks, why use diclofenac at all when there are alternatives?
That's a good point. While there are alternatives, diclofenac often works effectively for short-term relief and for conditions where inflammation is a major part of the pain. But it absolutely demands careful risk assessment and, honestly, sometimes a healthy skepticism from
Right,
both patient and provider.
exactly. Staying informed and vigilant is key. It's like handling any powerful tool. You need to know its capabilities and its risks.
Absolutely. And in the end, ensuring all these precautions and warnings are understood by everyone involved is, what makes treatment safe.
No doubt about that. Well, this has been super insightful. Diclofenac might be common, but it certainly is layered with details that demand respect and careful management.
Exactly. It's a clear reminder that every medication, even ones we take often, requires a thoughtful approach.
Thanks for unpacking this. It really highlights just how crucial it is to keep track of both benefits and risks when it comes to medication.
Absolutely. Being well informed, asking the right questions, and sticking to medical advice all go a long way in using diclofenac safely.
And for everyone listening, it's a solid reminder to never go off script with any medication. Always check with your healthcare provider if you have any doubts.
Exactly right. Stay safe and stay curious about how these medications work. Thanks for tuning in.